Hi, welcome to Health Matters. My name's Sherry Gallant with Alberta Health Services, and today we're talking with Chantal Wog. She's a student health inspector with Environmental Public Health, Alberta Health Services, and because we're in the middle of winter now, we are in the joyous time of norovirus season, aren't we?
Yes, we are.
And so we're going to talk about noro, what it is, how to prevent it, and what happens when it happens, sort of thing. So let's start off with, what is it?
All right, so norovirus is an infection of the intestines caused by a virus.
How do you get it?
So it is basically contracted by ingesting contaminated food and drink, ineffective hand washing, and if you're in close contact with somebody that is ill or contact with bodily fluids of people that are ill. And those are mainly the biggest ones of how it's being transmitted.
So essentially someone has to have it, and then if they have poor hand hygiene,
Yes.
they can spread it
Yes.
to things that other people might
That's right. So yeah,
touch.
if you're not washing your hands after going to the bathroom or washing before and after food prep, then you can transmit it to other people.
So there you've just sort of touched on it, so that hand hygiene and whatnot, but what are some other things that we can do to try to prevent it?
Sure, yeah. So obviously hand washing is the number one thing that you can do to prevent it. If you want to use a 70% alcohol-based hand rub, that will help, but I mean it's not entirely effective if your hands are soiled. You want to make sure that they're being washed, and you can supplement it with the hand rub as well. And you want to make sure that you're sanitizing surfaces with appropriate, I guess, sanitizer. So
And you've brought
I brought
particular product.
That's right. So any household chlorine, unscented. So you want to make sure that you are getting about 5 tablespoons of chlorine to about 4 liters of water for any surfaces, like tabletops, doorknobs, that sort
Things
of thing.
that people commonly
Yeah,
touch.
high touch areas, yeah, is what we call them. And any blood or bodily fluids, we recommend that you use about 1 2/3 a cup of the bleach to 4 liters of water.
Okay. And then I guess if someone in the house is ill, you just kind of keep doing that?
Yeah. It usually lasts between 1 to 2 days, and some of the signs and symptoms are you feel nauseated, you have abdominal pain, you're vomiting, diarrhea, that sort of thing, and you feel that way about 12 to 48 hours before becoming ill. So those are mainly, I guess, the tips.
So then once the
look
illness
for.
actually starts, it's about 1-2 days?
That's right, that it lasts for healthy people. If you are sick, or if you're not as healthy, so if you're a senior or young, immunocompromised, it can last up to 7 days. And yeah, it can be severe for
Take
them.
a bit of a toll.
That's right, yeah.
Okay. So what is if you're a working person and you get this, what is the most important thing to remember?
Right, so we want you to make sure that you're staying at home when you're ill, at least for 48 hours after you're symptom-free. And we want to make sure that you're not preparing foods for other people when you're ill as well.
Okay, great advice. Anything else that we haven't touched on?
Just want to stress hand washing is the number one thing that you can do to prevent. Stay at home when you're ill, and don't prepare foods when you're ill as well.
Thank you so much.
Thank you.
Stay healthy this winter, and thank you for watching.